Hi guys, my name is Kyla Lynn and this is my presentation over elephantiasis. These are pictures of elephantiasis in the lower limbs. So right here is an anterior view and a posterior view and then a lateral view. So you can see the swelling throughout the tissues caused by the filariasis. Disease pathology. Elephantiasis is a more extreme or often interchangeable term for lymphatic filariasis that is caused by Buergia tumori, Buergia malayi, or Wucheria bancrofti. These bacteria are filarial nematodes. That means they are round, unsegmented helminths with pointed ends possessing their own digestive tract, and do not interact with the human intestinal tract, but rather their lymphatic system. It is not the worm specifically that causes the filariasis, but the microfilaria that female worms produce. So once a new host has been infected, these microfilaria larvae move through the circulatory system to deeper nutrient-rich body tissues where they can finish their maturation. Adult worms safely hide in organ capillaries during the day and travel throughout the bloodstream at night. It is here that microfilaria begins to block off flow and drainage ability of the vessels over time, leading to filariasis. This can occur rapidly or even over the span of up to 17 years. It depends on the amount of mosquito bites that the victim has interacted with, each resulting in increasing amounts of lymphatic damage, most often in the limbs, but sometimes in the genitalia of both males and females as well. So what happens as this microfilaria block off your lymphatic vessels, this lymphatic vessels run all the way through your body. So it has central points in your lower legs, here at your hips, and then up here in your shoulders and your armpits. So as this flow gets blocked off and it can't make your way up, there's profuse tissue swelling. So the profuse swelling of surrounding tissues, once this continues for an extended amount of time, your skin's outer layer over the affected areas will develop a thick, dry, dark, pitted appearance that can sometimes become ulcerated because of the blocked flow. Victims are at an increased risk for secondary infections because of this. Your lymphatic system is compromised, which is part of your immune system. So as your immune system is compromised, it can't fight off secondary infections, such as Staphylococcus or Streptococcus. These bacterial nematodes infect the lymphatic systems of over 120 million people throughout the tropic areas of the world, such as the Caribbean, South America, the Pacific Islands, Indonesia, Southeast Asia, India, and Africa. Lymphatic filariasis is endemic in over 80 countries, and over 1 billion more people are at risk for this disease. This can also take a heavy toll on an already struggling community that is most often unable or struggles to support an extra burden after losing another working member of their family or society. Disease management. So this leaves healthcare professionals with two diagnostic screening methods. Option number 1, blood samples can be taken at night when the microfilaria are circulating and then viewed microscopically on a slide for identification after being gram stained. Option 2, through immunoassays where antibodies are used to detect bacteria antigens in the patient's blood. These are both fairly inexpensive and cheap ways of diagnosing this disease. Once a diagnosis has been made, the most effective form of treatment is diethylcarbamazine to kill the microfilaria and the worms. Once the worms in this have been dealt with, you can then treat secondary infections with antistreptococcal antibiotics. In many cases, medical therapies such as these alone are not enough to help an individual, and there sometimes requires surgery or radiation to either remove the limb entirely or reduce the swelling and blockage and repair the damage. Pharmacological impact. Since the early 2000s, following a resolution by the World Health Assembly, a global campaign has been initiated by the World Health Organization to implement and eradicate elephantiasis. 2 inexpensive drug combinations as low as 3 cents a day, DEC and albendazole, and then albendazole and mectazan are mass distributed annually by region. with each different drug distribution dependent on an individual country, their decisions, and entry points in both rural and urban communities. This program has experienced tremendous success already, with lymphatic filariasis transmission on its way to being eliminated. Anemia and disabilities have been alleviated, skin diseases are being brought under control, and the nutritional health of individuals improved. These are some more reasons this organization has done such good with this program. Through this movement, healthcare systems are being improved, the drug distribution system has been upgraded, and more disease interventions are being made. That means that while these individuals are in there working in these endemic countries, they can treat not only elephantiasis or lymphatic filariasis, they can treat all these other diseases like these with simple vaccines that have been donated. So with this success, there have been reduced cost of treatments and surgery, establishing a healthier and more financially stable populace that can allow its members to work and go to school. Families reduce the burden of caring for their disease-struck relatives, and healthier women allow for better birth outcomes and a lower infant mortality rate to better enable a community to grow and prosper. So these families and these communities aren't having to carry the weight of these sick individuals who can't work, who are in so much pain and suffering every day. It allows the entire community to work and better and help these communities prosper instead of being poverty-stricken. This program has proved that the transmission and infection of lymphatic filariasis could be stopped or completely eradicated, and this world could have one less crippling disease to anguish over. A prevention plan. The best possible self-prevention methods rely on insect repellents or mosquito netting, wearing loose, long, or light-colored clothing, or simply remaining indoors at night when mosquitoes are most active. And especially endemic areas where there is a concentrated population, eliminating standing water can also decrease mosquito population numbers and therefore the risk of filariasis. Areas with wealthier communities have another option of introducing widespread insecticide spraying to help manage mosquitoes and infection rates. So this is saying that after these individuals have been vaccinated or been given these drugs to help cure them, these are some prevention methods that help them not contract this disease again. And they're very inexpensive. It's really just eliminating this mosquito and to prevent the biting, because this is where this infection enters the body and spreads. Elephantiasis is caused by a horrid bacteria that has taken a toll on millions across the world, but can easily be prevented and eradicated if individuals could donate the time and money to take action in these poverty-stricken countries.